Hi, my name is Daniela Hurtado, and today I will be going over the food pharmacy quality improvement proposal at Tamagua. Tamagua is a clinic that offers services to the uninsured and underserved communities in Tomball, Magnolia, and Waller. On the next slide, I will be reviewing the importance of using our resources wisely as children of God. From everyone who has been given much, much will be demanded, and from the one who has been entrusted with much, much more will be asked. Luke 12:48. As we're here on earth, children of God, we cannot just be walking around aimlessly, living our day by day with no purpose. It is very important for us to use these resources, use these tools to help people, help our community, and show them who our God is. On the next slide, we'll be going over the objectives and the purpose for this proposal. First, it is to improve quality and procedures of the food pharmacy. Next is to propose screening protocols for patients. And last is to guide patients on the different nutrition and education options. On the next slide, I will be going over the social determinants of health survey. Social determinants of health include all the factors, social, economic factors that can affect the health of a person and their community. This survey was assessing different social determinants of health, different needs, and with this survey, I was able to find the greatest need, or at least a need that already had an intervention in place and that it could be further developed. On the next slide, I will go over the survey results. There's a table that focuses on the community needs on the left side, and on the right hand side, the percentage of impact. The top 4 needs being healthcare cost barrier, literacy barrier, utility insecurity, and food insecurity. Out of these 4, food insecurity was the 4th greatest need at Tamagua, and it was something that already had an existing intervention at the clinic, where I was able to use this intervention and further develop it. The next slide talks about the food pharmacy history. It was launched here at Tamagua in 2020, and it started off with funding through CVS Pharmacy and Trinity Lutheran Church. With this funding they received at the beginning, they were able to support or feed 130 families within the first 6 months of $5,000, using $5,000 in grants. The targeted population were pre-diabetics, diabetics, and hypertensive patients. The next slide focuses on the barriers that I identified at the beginning of my research. The first important point were inconsistent qualifiers. There was not a set procedure in place to find the patients that qualified for the food pharmacy. There was no screening tool in place. The second consisted of inadequate education. I had the privilege to create a few interview questions when these patients came to receive their bags of food every Thursday. And one thing I realized is that there's very poor patient understanding. Many of these patients believe that these are just bags of free food, but they don't really understand the impact it is creating on their health. The third important point was the limited availability. In 2022, there were 1,074 patients in total, consisting of pre-diabetics, diabetics, and hypertensive patients, and only 6% of these patients utilized the food pharmacy in 2022. That is quite astonishing, and definitely something has to be done. The next slide gives an example of an existing food pharmacy in Harris County called Food Pharmacy Harris Health. It has a partnership with the Houston Food Bank. They use screenings to determine food insecurity. And for patients that are only food insecure but do not have any chronic diseases, they provide 1 prescription for 1 trip. And then for long-term participation, patients need to have already a chronic disease. And this long-term prescription consists of fruits, vegetables, targeted education for them, nutritional guidance for their everyday living, and personal assistance for any social services they may need. The next slide goes over the screening that I would like to propose called the Hunger Vital Signs Survey. This is a 2-question survey determining food insecurity. It has been approved by the U.S. Department of Agriculture, and it is based off of the U.S. Household Food Security Survey module, which has already been used in different clinics, hospitals, for all patients to determine food insecurity. The next slide shows a screenshot of the screening tool that is actually already found in our electronic medical records known as Athena. So I thought that was pretty interesting. There's a screenshot there which shows how it would look like on our side. The next slide gives a little bit of information about the scores. Sometimes true is 1, often true is 1, never is a 0. So a score greater than or equal to 1 determines food insecurity. The next slide goes over the patient qualification process. From the moment a patient enters Tamagua to the moment that they leave, already being registered in the food pharmacy, there is a process, and I will discuss it here. The first step is patient identification. Patients must be identified as pre-diabetic, diabetic, or hypertensive. Next thing goes on to be the screening. So nurses will perform this yearly screening as they're going over their vitals. They will ask these 2 questions and record the answers on Athena, which is our EMR. The next step would be the diagnosis. Once the physician enters the room and they discuss this with them, they can include food insecurity as a diagnosis on the patient's chart. And the last step is the scheduling. There is a required patient education class in order to be scheduled, and this 5-minute video that will be shown to the patient will occur inside of the room with the provider. On the next slide, it talks a little bit about the patient education class. So this was something that I just mentioned. It is a 5-minute video for all first-time patients that are going to be in the food pharmacy, and this 5-minute video is shown by the nurse practitioner or the physician that is giving them help that day, that is seeing them that day. On the next slide, I talk a little bit about the long-term goals. Long-term goals include having funding through partnerships and grants. There are many places such as HEB, CVS, and maybe other churches that are willing to work with Tamagua in order to increase that funding and provide more food, more bags, and have more patients on schedule. Another point is expand education with informational videos prior to food access. So one of the things I have envisioned is to be able to show a 5-minute video or even 3-minute, 4 minutes, that videos that are out there that are really simple, easy to understand, and can provide the necessary education to each patient every week before they come pick up their food. And lastly, another goal is to schedule sets of patients bi-weekly to allow room for growth. Instead of coming every single week, they would come every other week, and that way we can alternate and allow more patients and be able to not serve only 6% of the diabetic, pre-diabetic, and hypertensive community, but be able to reach many more and create a greater impact on these patients. And the last slide goes over my references. Thank you so much for watching this video, and I hope it is a blessing to your life.